So we'll read the award. So this is to certify Dr. V.N. Bagadia BPS Lifetime Achievement Award 2026 has been awarded to Dr. Nandu Mulmule sir in the recognition of his extensive work. In recognition of his extensive work and invaluable contribution to community mental health and the advancement of related literature in India. On today's annual day function of BPS held on 12th April 2026. Thank you.
Hello. Friends, colleagues, seniors, it's a great honor. I am deeply indebted to Bombay Psychiatric Society for considering me worthy of this award. And one of the most satisfying experiences is to get the honor in presence of your teacher. And I am greatly indebted to Dr. K.P. Dave, Professor K.P. Dave, who has come all the way. इससे बड़ी कामयाबी कोई नहीं हो सकती, इससे बड़ा achievement. I thought that there were 3 words in this award: life, time, and achievement. जिंदगी, वक्त और कामयाबी. जिंदगी और वक्त तो हाथ से रेत फिसलने की तरह फिसल जाती है. Life and time go on. You don't have to do anything to achieve them. It's the achievement. Now, achievement is a relative word. Achievement is something which it's a one ठहराव. It's a one place where you reach after 70 years of age, and then you realize there are so many people in this world who have scaled greater heights than you. So one can get only humbled by this, that you are being felicitated for something which has been contributed by so many people. I remember my first day at Sion. I belong to Sion Hospital 80 to 83 phase. I still believe हिंदी फिल्म की ज्याला सुवर्ण युग म्हणतात. Songs of 70s to 80s were the best of the songs, and PG in psychiatry was best from 80s to 90s. That too at Sion. Because in Sion, nobody taught you anything. You are left free with freedom. कुछ भी करो. We experimented with, unfortunately, I have to say this, we experimented with the patients because we had a free hand given to us by teachers like Mrs. D'Souza, Dr. Dave. And, there was no formal teaching, but I have learned a lot from him and from Dr. Mundra also. I remember one day, patient of schizophrenia, EEG was done. There were some epileptic discharges, and I added an anti-epileptic to the repertoire of the schizophrenic drugs. And Dr. Dave said, Mulmule, तुम ईईजी का इलाज कर रहे हो या पेशेंट का इलाज कर रहे हैं? Such a great thing. You know, you remember Aristotle's sentence that I would rather like to know the man who has a disease than the disease a man has. So, this is teaching. And I believe that there is no teaching in this world, there's only learning. Change is the door that opens from within. You can't change anybody till he wants it. In psychotherapy, we learn the same thing. People change because they want to change, not because you are imposing anything. So that was the freedom and that was the type of teaching which was given to us. And I think I'm very uh, indebted to those days in Sion when teachers like these were there. And after 40 years in psychiatry, I have learned that now we are facing a sea of change. See, up to 90s, everything was okay. People were not so much burdened by the sudden change in the environment. You have begun with a body which is 3 lakh year old. Our physiology or anatomy has not changed even 0.001% for 3 lakh years. Now we are living in an age for which our body was not built. The greatest havoc which has created with our psyche and our mind and our body is the change, and the speed of change is such that after 90s and before 90s, we are burdened 200 times more information than what our brain can process. Before 90s, we were not burdened by so much media. Who could have thought that one day the biggest threat to psychiatry, psychology, human mind would be a screen of 2 inches, 3 inches? We are creating a havoc because 2 days ago I read an article in Times of India that the biggest users of social media in the world are in India. In 2025, 1.1 trillion hours were spent by Indians on screen watching, 70% of which is faltu media. That comes to 5 hours of watching every day. That's an average. That means the formative years of life, the adolescents and young adults are spending more than 7 to 8 hours on the screen. Now, this is a sea of change. I reflect back on my days when I feel what psychiatry did not have a ground to hold. अपना forefather तो Freud था, तो Freud never saw a black person in his whole life. Freud never saw an Asian person in his life. Freud never saw an Indian, a Korean, or a Chinese person. At the core, there are certain things which don't change across humanity, but culture makes a very big difference. We have learned Western psychiatry, our patient is an Eastern person. And it's not that वो खराब है या हम अच्छे हैं या हमारी संस्कृति बड़ी है उनकी खराब है. No, but we differ from them. We are trying to apply Western principles to our patients, which is not proper. Our culture is different, upbringing is different. We have developed as an agricultural based economy based on cooperation. Society is in the center and individuals are around it. In their culture, individual is at the center and society surrounds it. So the core values are different. Not that those values are bad and ours are good, they are different. Now we are trying to apply that to this. In 40 years of psychiatry, I have learned that we had first time we discovered neurotransmitters, and there was a term biological psychiatry, biologically oriented psychiatry. In these 40 years, I believe that you cannot break down human emotions and interpersonal complexities to neurotransmitters. In fact, I have come to the conclusion, little harsh sentence, that biological psychiatry is a defense against anxiety produced by the fact that we don't have a ground to stay on. तो हम चाहते हैं कि हर क्रिकेट थॉट के लिए कोई ड्रग हो. In those days, I remember even papers published in Indian Journal of Psychiatry, they quoted dexamethasone suppression test as a diagnostic criteria for case of depression. वो DST कहाँ गया? Now it's nobody knows that. This can't be the inclusion criteria. We are very complex as people who interact with each other, and now the complexity is increasing because of so many factors. I think there are very certain big differences between those people and we. The knowledge which we have gained, the Western psychiatry, and knowledge which we are trying to. Everybody is talking about REBT. Is man a rational animal? I don't think so. Rationality is not a default position. We are emotional beings. 80% of us, 80% of us means 80% of the human beings are still animals. We are animals at the core. We are trying to become human beings. If rationality would have prevailed, who would have thought of a person heading a biggest state in this world who is the most irrational person in this world, inflicting horror and war on humanity. तो rationality कहाँ implement करोगे? We are not rational. Our default system is emotional. If you want to at all teach people, teach emotional regulation, not rationality. Rationality है, लेकिन वो तो बाद में आएंगी ना. For every, see, the seat of emotions is 30 crore year old. We have a reptilian limbic system fitted in our brain. The seat of rationality is our prefrontal cortex, which is hardly 20,000 years old. So in terms of evolution, for every rational thought trying to calm down our emotion, there are 15 impulses from the limbic system which control us. Emotionality is our default mode. So I think first we have to know the cultural differences. We have to mold the psychiatry according to what our people demand, what are their value systems. So it's a long way to go to psychiatry. I think I have got only, if you have that alarm of 15 minutes, I'll know I'm not exceeding my time. But I suppose I can still talk for a few minutes. That we cannot take the words like cure and solution to a problem like medicine people take. Somebody mentioned about medicine people thinking about, psychiatry as a, yes, Dr. Prashant Shah said that he took up psychiatry and father asked, will you be able to earn? Today, psychiatry is a very coveted branch because everybody knows there's a lot of money. Increase in psychiatric problems is a sign of affluence of society. अब पैसा बहुत आ गया है तो दिमाग खराब है तो जाने के लिए टाइम है, पैसा भी है. Problems were there in yesteryears also. People were after the deficit needs of Abraham Maslow, security needs, social needs. Now this is a recognition need. Unfortunately, getting awards and my mood receiving this award, of course it's a prestigious award. गया बीत ही सावन तो घन लाया तो क्या लाया, बिछुड़ ही गया जब यौवन तो कोई भाया तो क्या भाया. मजा तो तब है बसंती चांदनी हो, कूक गाती हो। अगर पतझड़ में किसी कोयल ने बाहर गाया तो क्या गाया? I may have passed that age where I am having, I am happy receiving awards, but I am more contented. If they come my way, it's okay. If they don't come my way, it's okay. Question is whether you are after recognition need still after age of 70. That's not good. You are still in deficient need. Now you need to go a little up, or you haven't learned your psychiatry properly. You haven't imbibed Abraham Maslow properly. I was talking about those days. I was talking about the 40 years traveling this psychiatry. I have come to the conclusion that what you get from colleges is information at the most and at the best. Actually, it's data, not even information. You don't gain knowledge. Knowledge is something which is far beyond information. Unfortunately, we live in an era of the Google, where information is mistaken for knowledge. And wisdom is still afar. You know, you gain wisdom after you have gained a little bit of knowledge, experience, and humanity, humanitarian feelings. There is a Sanskrit word jna. Everything revolves around this. Ajna is an ignorant person. Tadnya is a technical person. We are all technical people because we are skilled at scanning symptoms, diagnosing, and giving treatment. We are not prajna. Pray, don't think yourself that you are doctor, so you are knowledgeable. No. Being a doctor has nothing to do with knowledge. You are a technical person. Prajna is somebody who gains knowledge, and then some of us become sudnya. Su is good, Jna is knowledge. When knowledge is applied to the betterment of yourself and the society, then you become Sudnya. And I believe that one day we reach a stage where we'll be presenting papers wisdom based psychiatry, not evidence based, because evidence may be misleading also. So, this is a journey from. Yes, 2 more minutes. Yes. Uh, li- Life and time both are limited. I accepted at the beginning only. So then we have come to this conclusion, and I think uh, there is so much to learn. I'll only say this thing that we have been taught the mature defenses. We all are using and have to use defenses while dealing with this world. Past is depression, future is anxiety. अब पुरानी बातों में उलझे रहोगे तो डिप्रेस्ड ही होगे और आगे का सोचोगे तो एंग्शियस होगे. You don't have respite. You have to have. Most of us are neurotics. Neurosis is a better thing. You all have to have something. You cannot be perfect. Neurosis is nearer to normal. The mature defenses, we have been taught humor, sublimation, and anticipation and all that. I think psychiatry emerged from psychology and psychology emerged from philosophy. We have to go back to the roots where you can find solution to others' problems and to your problems if you go back to philosophy, and the philosophical defenses are acceptance, forgiveness, compassion. These are the most important things. You have to tell people to think, to have a philosophical outlook to life, because cure and solutions in medical parlance have different meaning. You can cut a tumor and say that you are cured. But psychiatry patients tell me, have you seen a patient completely normal? He says that now I am great, feeling again. You have to deal with day-to-day problems. Even Freud said that what all psychotherapy can do is to reduce depression to day-to-day sadness. जिंदगी की रोजमर्रा उलझनों से तो तुमको जूझना ही पड़ेगा. So you have to go back to philosophy and go back to acceptance, forgiveness, and compassion. These are the real answers to uh, the problems, interpersonal relationships, असो किंवा depression असो किंवा whatever it is. I'm extremely thankful to all of you for giving me this opportunity, bestowing me this honor, and giving opportunity to interact with you. And in a few minutes, uh, काय म्हणता येईल त्याला आत्मचिंतन करता आलं की आय कॅन पुट फॉरवर्ड सम थिंग्स विच आय हॅव लर्न इन 40 years of psychiatry. There's still so many things to learn, but as I say, life and time presently is limited. Okay, thank you.